So now let's come to the history of preeclampsia. So how do you make sure the issue of a preeclampsia patient? So to bring out the issue of a preeclampsia patient, we need to bring out all the elements of the pathophysiology of preeclampsia. Is it clear? You need to bring out all the elements of the pathophysiology of preeclampsia. So in the history, when you receive somebody who has preeclampsia, is it clear? Generally, they are going to present with the symptoms or signs of severity. Is it clear? The patient that present in preeclampsia generally are going to present with signs of severity, or they may also present from an antenatal care consultation or routine consultation visit. But generally, if they just come from antenatal care or routine consultation visit, they're not going to be admitted because mild preeclampsia with a blood pressure of 140/90 meters of mercury is just a bed rest and monitoring. That's the best treatment for that. So those people are not going to stay in the ward. So the people that you're generally going to receive in the ward with preeclampsia are those that are going to present with the signs of severity of preeclampsia. And for you to understand the history and the physical examination of preeclampsia with their symptoms and signs, the symptoms and signs of the preeclampsia, for you to understand the pathophysiology of preeclampsia, you need to understand actually the pathophysiology. So for this, we are now going to explain the pathophysiology of preeclampsia. Are you understanding? Physiology of preeclampsia. Now, for the pathophysiology of preeclampsia, what are the elements inside the pathophysiology of preeclampsia? Now, the first element in the pathophysiology of preeclampsia is what are the changes that this results. So you need to know that preeclampsia is going to result to an increase in blood pressure. It is called hypertension. So that is the first pathophysiology of preeclampsia. We have the signs that hypertension are going to give, the symptoms that hypertension are going to give. Now, still, the next thing is that what preeclampsia pathophysiology is also based on what? It's also based on proteinuria, an increase in protein level, proteinuria. Is it clear? Now, and those are the two major pathophysiologies via which preeclampsia is all going to result with signs and symptoms. Is it clear? And now the next one, now we have the obstetrics, related pathophysiology, still based on the hypertension or the proteinuria. Is it clear? Now we need to know that what the complication of preeclampsia based on this pathophysiology, we have all the symptoms. So you have all the symptoms of severity. You need to know that the signs of severity of preeclampsia are going to be based on this hypertension. And what are the signs of severity you can have? The first one you can have at the level of the brain. Is it clear? Where the patient is going to have headache. Is it clear? So the patient is going to present review of symptoms. You can have headache. You can have signs of raised intracranial pressure. Is it clear? What are those signs? The patient is going to have headache. The patient is going to have dizziness. The patient is going to have dizziness. Going to have blurred vision. Is it going to have projectile vomiting? All these are a result of the hypertensive emergency. Is it clear? So you first start with this hypertensive urgency, which are the signs of severity. Is it clear? So we have headache, we have raised intracranial pressure, other signs of severity which show also hypertensive urgency. You are going to have also pain at the right upper quadrant. If you have pain at the level of the right upper quadrant of the abdomen, is it clear? It's also another sign of severity. Another sign of severity which is still related to a hypertension, we have chest pain. So chest pain occurring because of any ischemic heart disease. Is it clear? So those are the things that the patient is going to complain of. Is it clear? We have also at the level of central nervous system, we have also scotoma. Scotoma, it means that what you have dark spot at the level of the eye. Is it clear? So those are the different signs of severity that the patient is going to have. Is it clear? Now, after having these signs of severity, the patient now is going to, if anything is not done, when the patient has the signs of severity, the patient is now going to have complications related to the hypertension of the preeclampsia. Is it clear? And what are the complications related to hypertension? The first organ that can be damaged is the brain. Is it clear? And when the brain is damaged, it can result to a stroke. Is it clear? Generally, the patient is going to have a hemorrhagic stroke. Is it clear? or even an ischemic stroke. Now, because of that increase in blood pressure, the next one, you can have a subarachnoid hemorrhage, which is another complication. The third complication, you have a hypertensive encephalopathy. Is it clear? So those are the complications that you can have with respect to the hypertension. Is it clear? So now the next organ which can be related to the complication of hypertension in preeclampsia, we can have the heart. Is it clear? In the heart, the two major complications you can have an ischemic heart disease. Is it clear? You can have an ischemic heart disease, or you can have an acute left ventricular failure, or so acute left heart failure. Is it clear? Acute left heart failure. Acute left heart failure can occur also because of the hypertension in case of preeclampsia. Is it clear? This acute left heart failure is going to be result as a result of what? You need to know that what hypertension results to what? Those vasoconstriction. I've said that you have vasoconstriction, which is going to increase the total peripheral resistance, and the total peripheral resistance increase the afterload. It means that what? The left ventricle will have to pump up to a very high resistance, and when the left ventricle pump up to a very high resistance, it's going to make now that left ventricle to fail, and it's going to be called an acute left heart failure. Basically, so generally that's that. The next thing you are going to also have, and this is going to present with signs of pulmonary edema. Is it clear? How this is going to present? It's going to present with signs of pulmonary edema. Is it clear? I'm going to tell you the presentation of each of these complications. The next thing is going to be the kidney. Is it clear? The kidney can also have damage. Is it clear? And how is the kidney damaged? The kidney mechanism damage is going to be acute kidney injury, but there are two major mechanisms via which hypertension can result to acute kidney injury. The first mechanism is a thrombotic microangiopathy. Thrombotic microangiopathy